Welcome to another episode of Innovation Somalia. I am your host, Abdul Ali. I'm coming to you from Columbus, Ohio. I'm really excited. Today's guest is somebody that I've been trying to get a hold, not necessarily the person, but somebody that with that expert, with that understanding of the topics that we're going to be talking about today, which is psychology, therapist, mental health, maybe a little bit of addiction. And I'm really excited to have her, and she happens to be Somali, so we can really hit the nail right on the head about the topics that we're about to kind of sort of discuss. So her name is Roda Hassan. Roda, thank you so much for taking the time.
Oh, thank you.
I
Thank you for having me.
Thank you. I'm really excited. I can't wait to get into this discussion because it's been long coming for me in a sense of somebody with your qualification. So tell me a little bit about you.
Okay. Well, so I have a bachelor's in psychology.
Okay.
And then I have a master's in social work.
Okay.
And then I had to get a clinical license, so independent clinical license.
Okay.
So I work as a therapist.
Okay.
Mental health therapist.
Okay.
So there's like different routes to get to be a therapist. So you can go to like specifically for family counseling or marriage and family counseling or psychology or social work. The critical thing is you have to be licensed by the board in your state.
Okay.
So I got licensed and I'm a therapist with a background in social work.
Nice.
Yeah.
Nice. How long you been doing that?
I think I've been independently for about 14 years, but I've had my degrees since 2004.
Oh, okay.
Yeah.
Okay. So
I worked in other, aspects of social work and like community mental health and all those things.
okay. Do you mainly, like, in terms of our community Somali, do you mainly deal with Somalis, or just a combination of pretty much anybody that you can provide a service for
Yeah,
too?
just anybody.
Okay.
The Somali part is that I'm, a Muslim and I'm bilingual, so that's a plus, right?
Okay,
Somebody
okay.
that understands your culture.
Yeah,
So
yeah.
I actually come from another state and city.
Where
Actually,
where you from?
So I went to school in New England, in Massachusetts.
Okay.
But I lived in Cleveland, Ohio, and there weren't that many Somalis back then.
Yeah.
So an event in my life happened, and then I'm like, I gotta make it count for Hassan. It has to be purposeful work.
Absolutely.
And then I figured like we all have trauma, and it doesn't have to be dagali or hasi. It doesn't have to be soqahne and things like that. It could be a family trauma. It could be generational trauma. It could be just identity crisis, because we struggle with that too. So
there's a lot we struggle in terms of Somali community,
we're
for
just
sure.
like everybody else.
Yeah. I don't know about everybody else. It's just anybody that went through the Civil War, I would say.
Civil War, displacement, all kinds of stuff. So, so then I came here. So 2010, in May is when I started my practice.
Okay.
And so I've been doing that. I seen all kinds of people. Somalis, other Muslims, Africans, Americans, men, women, children.
Okay.
Yeah.
It's we're gonna dive into all of that. And what inspired your journey to go into this route in terms of the mental health and doing therapy and all that?
So like I was saying, that an event happened in my life in like 2009. So I was working in child welfare, which is children's services.
Okay.
I was a case manager. I had my master's. I had my license, so I could have done this work then. But sometimes you get into a position comfortable, you get paid well. You're like, pay my bills, I get to go on vacation, whatever. Just
right. Yeah.
The American
dream. The American
right?
dream, the American life.
Yeah. So then one day I was fine. I think it was a Tuesday. I just remember it was the day that Michael Jackson died. I don't remember the exact date. I just remember it was in June. So when I was just feeling dizzy, and then I went to Dr. Kantege, like 𝐸𝐔𝐘𝐒, and then a doctor was like, you're dizzy because you have cancer. But I didn't have cancer.
Wow. Okay.
Yeah.
Okay.
But he said that, and then like my whole life flashed in front of me. And then I thought, well, you know what? I'm gonna. I'm very like calm person. I'm very logical, process-oriented type of person. Like, I have to live a life that is meaningful, and I have to I don't want to just have a job. I want to have, or just a career. I want to have a meaningful career where I feel like I'm making a difference, and it has not just, financial benefit or extrinsic value, but intrinsic value. Like it's meaningful to me.
Yeah.
So, the 3 goals I set for myself was like to get better in my deen, and then to just live mindfulness, like every day is in the present, right? And then 3, to do something that I really wanted to do in my career. That was also meaningful. So then I had surgery. I had brain surgery, but I'm fine. I didn't have cancer. It was just tumor. It was non-cancerous tumor. So I had to have that surgery, and then once I recovered, I just started the process of wanting to relocate here because there were larger Somali population, and I just had.
Was it a family here at the time, or just
nobody?
Okay.
Nobody.
Okay.
My people, right?
Okay. Yeah. I like it.
Yeah. So then I just every day I would do something. I would have my shaqadeeda waa haystay, you know. It was the height of like the financial crisis, so I sold my place and moved here. And never looked back, and and it's been initially I had a little bit disappointing because
how so?
Like we don't trust like doctors or mental health professions or whatever. Lakin after that then it gets they're like, oh, okay, you're not against me. Like they don't like to tell things to
absolutely.
And they don't know me, right? And they just know my name, and I have this office, and so but it got better. I think there's a lot of awareness. The needle is moved a little bit, but not where we need to be.
No, not where we need to be. Absolutely not where we need to be.
Yeah, so it got better. Now people are like, even social setting, counselor, like it's I don't know anyone, like I don't know somebody that understands me, that doesn't judge me on my culture, but it's not like, hey, aniga buqiga ma furna, but what is it called? Boofism high. But how do they I feel like people are getting it better.
What is the misconception of the mental health that our people have when it comes to discussing about it?
There's so many.
But
I think one of them is maybe like dinta, that is not, your faith is not strong, right? Like you're not strong enough. You're supposed to pray more, and so that should take care of it. Or dadka kale ku caynaayo waxaa lagu maleynayaa qof daciifa, or ciyaalka laga qaadanaya haddaad tirahdid, like if you have heavy depression, and sometimes it's hard to do your basic things, take a shower, eat dinner, whatever. It's hard when you're severely depressed.
Absolutely.
Dadka qaarkood, they don't even brush their teeth. That's basic, right?
Yeah.
So marka ciyaalna way haystaan. So waxay ka baqaa in la dhaho ciyaalka laga qaadaya.
Do you think our own culture, it's actually pushing some people toward to depression and toward to like the mental health type of situation?
It could be, but I just think life is just hard.
I agree.
I think. So even though I studied this, I also am a strong believer in that we had different, like, culture is so important in good in positive ways, right? So maybe back home, maybe if your family's here, like back home, it was we had mental health without calling it mental health. We had family support. You know, like there was a good life-work balance.
The stress that's open to you here, it didn't exist back then.
Right.
Yeah. Bills and all that stuff.
Right.
Then,
it was,
yeah.
And then that was enough.
Yeah.
Right.
For everybody. Yeah.
But now we're trying to keep up with the Jones, and it's so stressful, and we're isolated. So there's like mistrust with your within your community, within your neighbors. You don't even know, and people could be struggling.
Absolutely, within your neighbors, you don't know. What are the early signs for depression? The early signs that you can think of, like, okay, well, hey, if you're experiencing this could be helpful to you.
So, when I see an older person, they older of Somalia, you know, they're like, you know, like those kind of things. And then they go see their doctor, and you know, pain pills or whatever, or a sleeping pill. But the doctor only sees you 15 minutes max, right?
Right.
So, and you don't get a chance to explain, well, why do you have a headache every day, or what else is going on? Most doctors don't have the time or the flexibility to ask you that time. So maybe another family member could recognize it, like 𝐓𝐇, like maybe you lost interest of things you used to do, you know, oversleeping or sleeplessness, you know, insomnia or hypersomnia.
What can they do to kind of sort of help them to get out of that at the early stage, you know, just to kind of sort of go back to
better
themselves? Yeah.
So being, you know, it depends, right, who I'm talking to. So if I'm talking to a Muslim person, of course 𝐓𝐇 is helpful, right, like for you to do your daily dhikr. Like that's in American, it's like in psychology, it's like mindfulness. Have a good work-life balance. So 24 hours in a day, right? So or close to that as possible. It's almost impossible.
It is impossible.
And then or whatever, or close to that as possible for self-care and your responsibility, and that has to include in your daily life. So if, let's say, things are not getting better, your focus in your self-care is not getting better, and I'm not saying like, oh, massage that's not feasible,
right,
you know,
right.
But like, you know, 15-minute walk, or you know, just praying, and then talk to, like, who's your network or who is your support system. That helps too.
That helps a lot.
And then finding an outlet for your stress. Everybody gets stressed, and everybody needs an outlet for their stress. If those things don't work, then come see me. Right? We're gonna like
unpack.
Peel the onions and figure out what is the root cause of that. And I don't tell you what to do. You come up with what works for you, right? So that's the thing about therapy. I don't know everything. I don't know a lot of things. I just know from what you tell me, based on my training, how I can, you know, navigate you through your life and the life that you want to live, not what I want you to live.
What are the mechanism of coping with those type of challenges? And, you know, let's just say we passed on you know, 𝐷s and all that stuff. Now it's becoming more of the day-to-day type of struggle, getting out of the bed type of situation, brushing your teeth type of situation. What are the coping mechanism to continue doing that, to continue to motivate yourself?
Sometimes I think you need outside reinforcement, right? Like sometimes maybe you're a single parent, or you don't have someone else to be like, okay, let's do this, or you don't have a friend that's there for you to be like, you need to get help. So it's up to you, you know, to seek for a consult, talk to your doctor, and ask for a therapist. You know, I'm big I'm big on therapy, so you ask for a therapist, and then you try that first. And if it's, you know, we can tell you like, hey, this is really severe. Like maybe you're at risk of having suicidal thoughts, you know, or maybe it's postpartum related, like, you know, homicidal thoughts. That happens too, you know. Before we get that, because we have to report those things.
Right.
That's not confidential. I have to, you know, involve emergency
authority
services.
and all that. Yeah.
So before we get that, let's get some help. Let's try medication. Let's do the weekly therapy. Maybe we need to do even more than weekly therapy. Maybe we need to do like intensive outpatient therapy or inpatient. Sometimes let's go 𝐓𝐇𝐈𝐒 stay in the hospital until they can get their regimens straightened, and then, you know, group therapy, those kind of things. So,
what about those that really don't believe in that?
Well, then you are disservice to yourself.
Yeah.
Like, how much is your life worth? You know.
Exactly.
Yeah.
Exactly.
And then who are you risking? Like, they're missing out on their moms, right? They're missing out on a healthy parent. Their sibling are missing out on a healthy parent, or 𝐕𝐈𝐃𝐒, you know, like, and most importantly, what about your life? You know.
Yeah,
so,
those are like a really tough.
Yeah, aren't you valuable? Like, you have a chance to wake up. You woke up today, so shouldn't you? Alhamdulillah, do something about it. You know.
Yeah.
Look to 𝐓𝐘𝐒. You're not just gonna be like, my doctor, you know what? 𝐓𝐘𝐒. You would go see. You would get, you know, just right? But
yeah.
So that's what it is. It's like, really, like, I think if we look at mental health as part of physical health, then that whole stigma of what would people think.
I want to dive in that a little bit more into it. What are the stigma that, you know, like the people have that's preventing from them seeking out? I'm talking about our community, right? You know, like what's preventing seeking out help? Because you see, there's some people that may need the help. They know they need the help.
Yeah.
They are more worried about how others are going to view that. Let's talk about that a little bit.
Yeah, so including me, right? So including providers. I'm not the only Somali provider here. So sometimes like, this is
deep.
Yeah, and we are licensed. So I have a license to uphold, and ethically, I didn't spend all these years in school and training and all this like hardship just to be like,
Right,
you know. So I'm not here to talk about you.
Right.
I don't judge people who are struggling with depression or anxiety or mental health, because that could be me.
Right,
you know, that like, who's
right.
to say like my life is perfect? Nobody's life is perfect. So
I think a lot of it has something to do that, not necessarily that the confidentials and between patient and doctor, I don't think that's much what they worry about. It's just the fact that to be seen, just the fact that to be known that, hey, that person is talking to somebody else to kind of sort of get help.
Yeah.
That itself is a stigma.
Yeah. Yeah.
And I think the challenge is that, and a lot of people really feel much better and don't look back when they start talking to a therapist. But I think that first step, that is just so heavy,
so difficult,
so difficult. Yeah.
But it's, you know, it's not. You have to know that it's not just specific to Somalis. Like every community feels that way.
I agree.
You know,
on that, yeah.
like yeah. But it's the first step. I think once you see it, you see a therapist, then you. This is a non-judgmental zone. There's no right or wrong way to do it.
Yeah.
You just you go there and you tell your story, and then you leave it at that couch.
Yeah.
You know? And then next week you can't wait to come back and talk about it more. And you know, and it's such a, like, I don't know, it's form of exercise, right? It's like they wait for their tears until they come in the office in my room, and then they're just like, they just verbal vomit, right? And then like, okay, I'll be back next week. And this is part of their self-care. It doesn't have to be wahwain in a haistan. it's just giving them a space
Yeah.
to talk and no judgment. Even hita, I think I would think one of the biggest thing for people to talk about is their family stuff, like parenting. Like, and it's, hey, well, that's fine, but what can you do? What do we need to do?
Yeah.
Because obviously you feel that this is a problem, like
right.
Yeah. So I'm not a Latalia, but I am where you unload.
I mean, this was like about a couple of years ago, maybe about a year and a half ago. I came across a social media post that this young lady that I think they were all in Minneapolis, and she was speaking on kind of sort of on a setting of mental health, where a bunch of people from Somalia came, and she was one of the speakers, and and one of the things that she said that this is, we're talking about 18, 19, 20. She had a rough life on the last 5 years at the time of her speaking. She said that people at the masjid, people in the community places, people that you feel like you can go talk to them. You guys made it so hard.
I
So
remember
hard.
that. Yeah.
So hard for me to, so hard for us to seek help.
Yeah.
Nobody in their mindset that kind of gets up in the morning and says that I want to be, using drugs all day. I want to be
I've
sitting.
seen that. Yeah.
You know.
Yeah. Nobody.
At some point, I think it's what I kind of want to talk to you about, and I'm bringing that up point to kind of sort of say, okay, where the mental health and the addiction, where
they
yeah,
intersect.
yeah.
So sometimes, let me talk about the mental health piece.
Okay.
It doesn't have to be waxbaa kugu dhacay or you just had a baby, so postpartum.
Right.
It doesn't have to be that. It could just be the way brain kaaga Ilaahay u suubiyey.
Absolutely.
Right?
Absolutely.
So, and then there's something that you struggled all throughout your life, but now that your brain is fully developed as an adult, gabdaha, like it's like 23 melahas. I mean 21 Wheelish is like 23. So your brain is fully developed and you have this mood disorder, right? So and now you're independent kind of, and the next stage in life, your stage in life is like friends and for finding your own network. And then you find, hey, drugs might be the answer for this, to quiet this mind down. And then it becomes, it's a street drug, so you don't know what's mixed in it, and it's not controlled. And then now you have a different problem, But maybe along the way, there were some signs. Maybe when you were a teenager, there were some signs. Maybe when you were even middle school, there were some signs. And we just attribute it like, whatever it is,
and that is just a common
behavioral thing. And then marraba in system 𝐓𝐇𝐈𝐒 ugalayo forever.
Yes.
So you missed all those marks, and now we're 20 and this person has not just you had their outside influences. That's just part of life.
Yeah.
And then becomes addiction. And then now you don't know, was the addiction what's causing the mental illness? Or is it the mental health problem that's exacerbating the addiction?
That's a very good point.
Yeah. So because we missed so many steps along the way. So I would say, to parents, just be watchful. Just like you're watching their food, safety goda. You gotta also be mindful of their, mental health. And if you don't have good mental health, what about your child? They're gonna learn. That's how they cope. They learn the way that their parents cope. Yeah. So I think even if you don't believe me, just look at your life and see what you've experienced from your parents. It's generational, right?
Right.
It's generational. Yeah.
That's a that's a very well put, because I was talking to folks that really on the front line of the addiction side of it. And I've interviewed a couple of guys a while back. One of them said to me that the most dangerous time for a kid, it is between the hours of 3:30 when they go off to school and 7 to 8 p.m. at night. If you don't occupy them, if you don't give them something to do, an outlet, and that's where they intend to turn to things. And keep in mind, we live in an area where outside influence so easy to your kid. You know what I mean?
Yeah. I think that it could be, if it's not like urban neighborhood, doesn't mean there's more drug. Like it could be, heroin in suburban schools or whatever. Like you just never know. But occupying your kid and making, it's very important, no matter where you're at. But of course, certain neighborhoods, there's
will contribute
more,
to that.
more influences.
Yeah. Yes.
So, but I think it's hard to raise kids, and and you have to be well yourself as a parent, so that you can attend to your child's needs, and and get resources wherever you can. Like don't think like, oh, or whatever. Yeah, like get resources, but make sure you get culturally competent resources for your child and for you and for the family. And every family has challenges. Every human being has challenges, but how do we navigate through those challenges is a most important part.
Our challenge is a little bit different because I think any country that goes through a civil war, it takes a long time because the side effect itself will last for a long time,
for generations.
And I think that's where it's going through. Maybe you and I left Somalia at the time at the time of the civil war, but imagine how many places that we touched on before we settled for the United States, right? So that kind of shaped who you are, shaped me who I am. But imagine the ones that actually seen a lot of things, that it becomes so common to them in a way that your problem and my problem are like in two different scale, right? So who are you to even speak about what I'm going through versus, so that itself also has. So let's talk about a little bit about whether there's not civil war or there's civil war, what it takes to uplift your whole roots and relocate to another place. That itself has its own journey, whether it could be a positive, it could be a negative, but it somewhat will touch you or will make you who you end up being.
Yeah, absolutely. Yeah, so there's this theory called Maslow's hierarchy of needs, right?
Okay.
And the bottom of it, it's like a pyramid.
Okay.
So the bottom, shelter, safety, security, those kind of things. So and then you move to the next level, which is like community and connection and all those things, and family is like, I think the third level, and on it goes. So marka adig wixii basic needs ka ba oo laga interruption laga geli, it's hard for you to think about something else, right? Like it's hard for you to like pay attention to your mental health, or am I getting a good quality sleep, but whatever it is, who am I? Ask yourself, who am I? What do I believe? What are my values? Because basic gaga is like kaswa noloshada khatar ku jirta,
that's right.
So then we bring that with us. We grew up with that, or like adult ahead, you transfer it to your kids. We're like third generation, 3 generations in, right? Almost. The
like third generation years. Is just the third generation starting to pick up, depending on how but the average,
so
5,
then
7, 8,
you didn't deal with it, so you
parented
with that to your kids. You taught them how to like problem solve with anxiety, so those things, just like good things you can teach your kids in a positive way, you could also teach them negative ways of coping or negative ways of problem solving, or family dynamic and things like that. So, I
and
think,
sometimes you might not do that knowingly.
yeah, it's you're not. Who wants it? Nobody, right? So you do
Right.
it unintentionally.
Yeah.
So I think that's why it's important to have a space to, whether it's 𝐒𝐘𝐒, you know, at 𝐓𝐇𝐈𝐒 or a community or family or therapist. You know, if no one is hearing you and everybody's like, so like if you in a group of people and somebody talks about, so you don't even get the space right? So
Yeah.
I guess I'm promoting therapy, so I'm
No,
saying
it's
that.
definitely a lot of people can definitely use that.
Yeah. Go ahead.
No, I was gonna say that this theory that we're talking about, we talked about having the most basic things, right? The shelter, the food, and the peace. Now the second one comes in that community. Let's talk about that a little bit in a way that that we could be support to one another, knowingly and unknowingly.
Yeah. So we have a like, we're visible in Ohio, right? We're
Big time.
in Central Ohio.
Yep.
So, and there are people, organizations that exist that's supposed to help people.
Mm-hmm.
So if we like, hey, let's work together. Let's refer this person. They need more than ESL services, or they need more than after school lunch, or whatever it is. You know, let's think about the collective good and help this person. I think that would be our community. You know, we do a lot. We speak up when one of our kids gets into trouble with the law.
Yep.
You know, we come together for, I don't know, for causes, but I think there are some families that fall through the cracks, and I think there are opportunities to help them, and if they hear the same things from everyone, then maybe they will, you know, they'll do better.
No, I couldn't agree any better than that. Having the right people to advocate for careness and talking to other people will just kind of sort of, but I feel like there's still a little bit of a stigma, and hopefully that the more we talk about it, the more I feel like that could change in a way for the better.
I feel like you and I and a whole lot of other people, our generation, are screaming loud enough that we can change the tone, right?
Yes,
we can change it and
yes.
say, hey, it's okay just because you seek their mental health services doesn't mean يعني عقلك غير or whatever. But also just understand the basic thing, right?
Absolutely.
And nobody, like, don't look at other. Think about how you can better yourself. The more you look at yourself, the better your life will be. But if you're looking at somebody else, then you're just wasting your time, and you're gonna stress yourself out more because those people, Allah blesses them in a different way than He did you, and He tests them in a different way than you're tested, and the same thing for you. So
And I wanna seek to where this leads us. We talked about the early depression, the early signs, and how people can seek help. And now let's go through the process of somebody who is really needs more help than the average abdi, right? Like maybe a weekly, maybe outpatient therapy, as you talked
or
about,
inpatient,
or
or something like that.
So let's talk about that a little bit and figure out that the relations that heart medications can bring, in a sense of like for betterment of that individual.
So going back to earlier when I said look for the signs, right? So maybe the kid is teenager, whatever. So talk to the school people.
Mm-hmm.
Reach out to a community person if you're not comfortable with it, and they go with you. They will help support you, right? And then maybe ilmahan. Remember, brain development isn't complete until adulthood. So ilmahan markuu qof weyn noqdo, maybe qof oo kaligiis isku filnaan karin oo noqon karaa mogt. So the sooner you get them services started before the age of 18, then you can like haduu rabinu daawo qaato or haduu rabinu therapy tago or all those things, you can be the power of attorney, or you can like, you know, navigate services for them. You know, so then that way it's challenging. Like qof aanan maskaxdiisa fiyoobin aad leedahay daawadaada qaar. It's not gonna. It's so hard.
It is hard.
It's so difficult unless qofku some sense of reality uu ku jiro. It's like, oh, you think I'm stupid now? You're trying to drug me out. And these medications are not easy. Like this is heavy stuff, right? They're not easy. But they keep your child safe. Yeah. They keep you safe, you know? So at least that part, like in Tasi, it has to start earlier. We have to pay attention to advice that we get, or, you know, what we hear, and not just dismiss it. Like, get a second opinion.
Right.
Well, maybe it's schizophrenia, you know, you know, and that's heavy stuff.
Okay.
Bipolar is heavy stuff, you know. So
how do you know somebody that has a bipolar? Because it's
it became like bipolar.
Bipolar is like, let's deal with that, but at the same time it's like stuff is heavy.
One thing about mental health issues, mental illness, is that if it affects shaqadaada, your family, your daily living, like if it affects those things, then you need more help.
Let's unpack that a little bit. Shaqo, family, and daily living.
Yeah.
So let's use for the daily living. So like, give us an example of what could be daily living effect. That
like qofan like soo kacayni, like dadka markay soo kacaan oo yani habeen oo dhan soo jeedaa, maalin oo dhan wuu hurdaa, ma shaqaysanaya, ma personal carekiisa waa very poor. Winterki, you know, he's just going out. Summerku sweater weyn iyo coat iyo wuxuu xiray, like something is up, you know, like that's not normal behavior. Dadki like wuu ka cabsoonaya ama wuu la dagaalamaya, you know.
Could that be? Is that bipolar type of signs, or that could be? It could be
a lot of different things. It could be something is off.
Something is off.
Yeah, right. It could be. It's hard to say this is bipolar, you know, without without seeing the person. Yeah.
So now, then let's talk about so that is the family. Let's talk about the shaqada.
How about if you can't keep a job more than a couple of days or a week? Marba shaqa kabad. Shaqa raadina or shaqa ma watagaysid after interview, or maybe interview ga madafis.
Okay.
You can't get a job. That, you know, like those are basic skills. Like it doesn't have to be something like I don't know. Amazon truck driver. No. Like McDonald's ka shaqeeya, ma shaqeyn kartid. Yeah.
You can't just focus on more than 2-3 hours at a time.
Or even just a couple of days. I mean, a day maybe. And then you're like, no, I am not gonna work there. I can't. But you know, so it's something. Well, like wax ku jiidanay oo kula haray, you know. Yeah. But it's sometimes you can't pinpoint it. You just feel something, and maybe you don't even know, and your family member knows. Like maxaa khaldan. And we have tendency to dismiss, like adabdaru shaqaysan la yahay.
Yes.
Inuu shaqaysta ma rabo, kibirka laga badi. No, maybe there's something deeper going on.
We really need to advocate for that, because there's and oftentimes you come across, you know, people that will say that, oh yeah, he doesn't want to work, or she doesn't want to work, or
what young person doesn't want to work and don't want to have their own money to spend Starbucks, or we don't want to spend Starbucks, but some other stuff.
Not anymore.
Dunkin' Donuts. What other young person doesn't want to go to like whatever TikTok shop or Temu or whatever they buy stuff from, you know? So
this is very challenging in a way that for people to even speak of, because in order to fix a problem, you have to know it exists, and if you are denying that it exists, then you're pretty much denying that you are well.
Yeah, but
So,
at the end of the day,
yeah.
something is off.
No, people know.
They know.
Individuals know that something is off. It's just that they are more focused on how
dadka kale
maxay malayaan.
Yeah.
Kan muxuu nolosheeda ku sameynaa, how would
Yeah.
this affect me and all that stuff. They know. People
know.
trust me. No,
They know. Yeah.
They know. Yeah.
So then this I used to ask some of my clients, like, how does a sick mind know that it is sick? Right? Like, ماشي wax ku sheegi lahayd ba haddii wax ka khaldan yihiin, see ku ogaanaysaa inay wax khaldan yihiin? It's very difficult, right? Like, but haddii gacanta ku xanuunayso, maskaxdaada, the nerves of, your hand will send a signal to your brain, and then it will tell it, like, hey, gacanta xanuunayso. But your brain, how do you know how does the brain know that it's messed up?
It's messed up, yeah.
By your behavior. So if your behavior, and then you just maybe journal, like, or look at what are your patterns? Markay saan dhacdo, maxaa ka dambeeya? And when you notice your patterns, or it's your safety is at risk, then you're in trouble. Haddaadan dad kale haysanin, you know that you're in trouble. Because I see people who live by themselves, who dad aan haysanin or haddana dhahaya, and then they're like, you know what? I know I'm in trouble because xoogaa xanaaqa iga yara batay maalmahan, ma rabo inaan shaqada aado, shaqadii waan nacay, So you know it by the behavior that's not your normal behavior. Markii horena shaqa raadinaysa like nobody's business.
Right.
You found this job, you love it. But all of a sudden, I can't stand this place. What? Where did this come from?
Mm-hmm.
Well, this is not me. Is it really the healthy you, or is it something is off?
Interesting. I'm still stuck on, how...
How does the sick brain know
how
it's
the
sick?
sick brain knows it's sick.
If you don't see a doctor or whatever, your behavior, you gotta pay attention to behavior. So that's ayaanu ku mashquulin. Anaga isku mashquulina waay.
Yes. And you also said something very important about, anger. About xanaaq. That's also a form of not controlling yourself. That's a form of that constant battle with your thoughts, or in a way that you feel like it's outbursting. So let's talk about that a little bit.
So we say anger is a secondary emotion, right?
Okay.
So the first emotion could be pain or disappointment or just fear, something else. And then it's coming out as anger because you don't want to show your vulnerability or something, So maybe you missed, you don't want to pay attention to that,
So how can you, like, as an individual, try to cope with that? Or, one time I think I was listening to one of those self-help books, and one of the things that I think it was Emotional Intelligence, one of the EQ books, and I think it says something about you have a few seconds for you to react to any type of situation. That few seconds determines the outcome of your situation. So how do you bear with that? You know what I mean?
Yeah.
So a lot of our community, or a lot of the people this is just general. A lot of people really don't realize that, that quick 3, 5, 6 seconds could
make a difference.
Could make a big difference. Yeah. So then how do you, spend enough time to kind of sort of focus on that, then rather than the reactive? Because if you're generally speaking, if you if you can't control it, then basically you meet the wrong person. That'll be if you need to.
So remember I said, like, earlier, I was talking about mindfulness. So if you increase your dhikr, like, or because we're talking about Muslims, right? You do that, then you become more at peace.
Okay.
And then you take care of your stressors before it gets to that level, right? So you know, you're having some talks with yourself along the way before you even get to that. So the non-Muslim people, I'm like, okay, well, what do you do to take care of yourself, so that you are never, not never, you're gonna get angry, but you never cross the line of, like, it could be, illegal stuff, right? Reaction, you can beat somebody up, and now you have a different, you have a bigger issue. But yeah, so just incorporating mindfulness techniques, and that's some of the stuff that we teach in therapy. Deep breathing is a simple thing you can do every day. Like, how many of us, we're so stressed and wind up all the time, like 𝐕𝐈𝐃𝐒, traffic, whatever, that we're just like, let me just take a deep, literally take a deep breath for a few seconds, and then make that part of your day every day.
It's funny because deep breath, if you don't know, you think that it's a joke, but it really does work.
It really does.
It really does work. Yeah. It really does work. Can you discuss the importance of, we talked about, when there's something is off. Mm-hmm. And let's talk about a little bit about the importance of how to approach it when you first
notice.
Yeah, exactly.
So I don't think it's going to be like one-time thing. Like, I think it's going to be over time. Like I know something is off. Maybe I don't want to listen to my parents. They're getting on my nerves or whatever. They think I'm عيال whatever. I just want my independence. But I think maybe أصحاب الهد, you've isolated yourself, you're not there anymore, or the 𝐷𝐿, you see them moving forward in life, they have families, or whatever your goal is, maybe that's not your aim, maybe it's financial success or like independent living or whatever it is, and you're just not moving forward. Then you're like, wait a minute. And, one thing I want to stress is you are on your own path and your own timeline. So I don't want people to think like, hey, and then I should be there. Like, no. Or, my friends went to college and I'm not going to college, so I must be something wrong with me. I don't think that. I think whatever you wanted to do and you didn't accomplish it, or you're not in a path to accomplishing those things, then there's something wrong.
No, I agree with you. And if I can just touch on this, comparison is the thiefness of happiness. So, I'll
say that again. It really is, because, for sure.
Comparison is the thiefness of happiness. So if you compare yourself to other people, you're just setting up yourself
for failure.
Yeah. Nothing else than that. So, I like the idea of just, this is you, when I was a kid, when I complained about like, I don't have that because my neighbor have that. Hey, shantan for. But they each hold the important role.
Absolutely, yeah.
So, so don't compare. So that's that. But, I ran out of questions, and I feel like we're just scratching the surface, to be quite honest with you. What are some of the resources and support that individuals can look into it in the event that they feel like they have not been heard by their parents or by their community?
Seek therapy, or find your community. Your community doesn't have to be, it could be anybody. It could be your cousins. It could be your classmates. It could, what I mean? Like people that you really feel supported by. Yeah. And sometimes when you're going through some things and the people that are there might surprise you. Like the people that you thought would be there for you might not be there. And then some other people are like, whoa, like I wasn't expecting that. But yeah, so don't dismiss people because they come from a different walk, or they have a different ideology, whatever. You know what I mean? Like we're at the end of the day, we're people, and we're we're.
I mean, our conversation can go in so many places. I know our time is limited. There's a whole topic that I needed to touch about suicide. I just didn't, and it has its own foundation and different all that stuff. Yeah,
that's some heavy stuff. But please don't think because somebody is Muslim that they will not struggle with suicide.
No.
Yeah, I think we've seen that enough podcasters and people talk about it. It's untreated. Sometimes it's untreated. Oftentimes it's untreated mental illness that it got so bad, and the person could just be so quiet that they never shared. And other times there are signs. They may ask you questions like, questions that are not even related to suicide. They could be like, like what is in our family history? Our family history that deep, right? So, has there been anybody that committed suicide? But here we are so isolated. We're so like it can really happen to anybody. Nobody's immune to it. We don't know.
You don't know.
So keep an eye on your kids and keep an eye on your own mental well-being. It's just as important as getting a yearly checkup, with your doctor. Treat it like cancer. Like you do preventative care for cancer, right? Like you don't eat horrible food and say, well,